I think I would say that we need to have a much better understanding of how different groups are going to be affected disproportionately by this, and what measures need to be in place in order to support these differences. As we were talking about data, it keeps reminding me how the women that come through our services, for example, are almost always absent from this data, either from statutory services like the police or sometimes from national charities, just because these women are not going to access those services. At the same time, although the whole country experienced what was a really difficult, life-changing moment, the way that the women coming through our services experienced it was, if it's possible, much bigger in terms of scale and in terms of the disruption to multiple areas of their lives. At this moment, two things that are very key are going to continue to happen. So while housing, healthcare, police, and others are almost impossible to access, the enforcement of border controls will remain intact. So you will have problems contacting the police, but the police will experience no disruption whatsoever in informing the Home Office immigration enforcement team. We know that because of lack of access to healthcare, the health situation of these survivors was much more precarious, and yet the provisions are not made in how can we take into consideration these pre-existing disadvantages that will have disproportionate effects on these populations and do something with it. With domestic abuse, it's very simple. I mean, The Guardian reported that the increase in cases of domestic abuse was coming, and yet it took a very long time to find the funding and put it in place in order for us to support these women. A lot of the things we had to do, and I know that our evidence covers things like burnout, we had to do ourselves. So I would say we need to understand much, much better who is going to need what kind of support much faster, through the use of reliable data. We need to put measures in place that are broad-reaching enough and simple to understand enough to have the effect of supporting these groups. And we need to seriously look at how the disproportionate effects in particular groups are going to have a much wider effect on the totality of the population. We talk about, Mariela, who was a cleaner at a hospital, who is in a hospital setting, in context with healthcare providers, and in contact with, people who are coming to access healthcare services in the context of a pandemic. And yet, we don't give enough consideration as to how putting her at higher risk of domestic abuse, of getting sick, of falling destitute, will create a higher risk further down the line, and so on and so forth. So I think it's understanding the differences that will put people at risk, women, children, Black and minoritized communities, migrant communities, to put the measures in place quickly to address this, and to link how the different areas of life are going to impact these same communities to the detriment of the entirety of the population. Because again, these were our health workers, these were our carers, these were our cleaners, these were, all the people that we said were essential during the pandemic were put at risk unnecessarily.
Yes.
So better measures to be put in place. We know about the funding. We know about the suspension of certain conditions. We know about data collection, but it's really about having a much more nuanced picture that allows us as a country to respond to a pandemic in a much more prepared way when the next one comes on.